All right, folks. First, the CDC announces first U.S. case of coronavirus with an unknown origin. Health officials announced on February 26th that the latest confirmed case of COVID-19 in an individual in Northern California may be the country's first case of human-to-human transmission from an unknown source. Well, let's just look at this. This is a map of airplanes traveling around the United States. It could be that they're carrying it on all these airplanes from parts unknown. Let's go over and look at Europe. It's unreal. How in the world do they think we're ever going to contain this while all these people are traveling? There's Spain. Spain has at least 1,000 confirmed cases. Italy has a bunch. I wonder if this could be the problem. All of this air travel back and forth from place to place all around the entire world. We're looking at, this is Flight Tracker 24 that shows all the air travel that is happening at this very moment in time. And it's populating, so give it a second. Oh my gosh, how in the name of the Word of God will we ever contain this as long as these people are traveling around like they're traveling? These are all airplanes carrying hundreds of people, each one of them. Each one of these planes is carrying hundreds of people. That's China. Okay. There's Japan. Let's see, how many flights are in and out of Japan? Still waiting for them to all populate. All those little yellow star-looking things are planes that are currently flying around the globe. From Japan, and all these little planes are flying towards the United States of America. And we're wondering why the coronavirus is so bad. Those are all airplanes with hundreds of people that are traveling to and from God only knows where. And we're wondering why we have a person-to-person contact with an unknown origin in the United States. As long as we allow these planes to continue to fly, the virus is going to continue to spread. The Centers for Disease Control and Prevention said in a statement on Wednesday night that the patient has no known sources of exposure, like close contact with confirmed carriers of the virus. It added that the individual had no relevant travel history before the case was detected through the U.S. public health system. At this time, the patient's exposure is unknown, the agency said. It's possible this could be an instance of community-spread COVID-19, which would be the first time this has happened in the United States. Community spread means spread of an illness for which the source of infection is unknown. The agency added there is a possibility that the individual may have been exposed to a returned traveler who was infected and will update the public as they get more information. The California Department of Public Health said that the unnamed individual is a resident of Solano County and is receiving medical care at UC Davis Medical Center in Sacramento County. An email from the hospital revealed that the patient had been transferred to UC Davis Medical Center as a suspected virus patient on February 19th. However, the CDC did not immediately test the patient as they did not fit the existing CDC criteria for COVID-19. The CDC began testing 4 days later. Due to precautions put in place for the patient, there is minimal risk to patients and staff at the facility, according to the hospital. It confirmed the new case would mark the first known instance of human-to-human transmission of the virus among the general population in the United States, something health officials warned may happen. Well, you could doggone well predict it was going to happen with all those flights in and out, sending people home to self-quarantine themselves for 14 days when we know at this point in time that the incubation could be up to 24 to 27 days. And they're going to send them home and on the honor system that they will stay home, not go out, and not have friends and family over. And how in the world did they even get home from the airports where they were found to be, maybe contagious, or tested and found contagious? I mean, don't these people belong, in the hospital when they're sick? I don't know how this is working. Dr. Nancy Mazzononier, director of the CDC's National Center for Immunization and Respiratory Diseases, said earlier this week that it was not so much a question of if this would happen anymore, but rather a question of exactly when this will happen and how many people in this country will have severe illness. The authorities in California said that despite the announcement, the health risk from novel coronavirus to the general public remains low at this time. While COVID-19 has a high transmission rate, it has a low mortality rate, the department said in a statement. From the international data we have of those who have tested positive for COVID-19, approximately 80% do not exhibit symptoms that require hospitalization. Well, there's the answer to one of my questions. California is carefully assessing the situation as it evolves, it added. The case marks the 60th in the United States, including 42 who returned from the Diamond Princess cruise ship that remains held off the coast of Yokohama, Japan, and 3 who were evacuated from Wuhan, the center of the virus in China. The CDC's statement comes after President Donald Trump named Vice President Mike Pence as the leader of the coronavirus task force. He said, "Whatever happens, we're totally prepared. We are ready, willing, and able." Excuse me, but there are only on hand at the Department of Homeland Security 300 million masks. And that's just for the Department of Homeland Security and medical staff. That does not cover the millions of Americans that will need masks to wear. There's one company that we know of in the United States that's producing masks, and they're just overwhelmed. They're working like 24/7 to try to pump out these masks, and it's just crazy that the need is so great. There's the president giving the speech. I really don't think that the advisors that he talked to before he went to that podium gave him the full story. He didn't seem to even know what it was like. Is it like a flu, he says? He asked them. What did they tell him? They should have asked somebody on YouTube, a truther, who could really tell him what's going on. Because the way he was talking, it didn't seem like to me that he was well informed. Pence will now be working with Health and Human Services Secretary Alex Azar in an all-of-government effort to coordinate the administration's coronavirus response. And Trump said that there were places that they could quarantine people, but he didn't say where. Neither did anyone else who went to the podium say where they were going to quarantine all these people. But it seems to me that all of them that are suspected travelers have been sent home to self-quarantine themselves. When asked about updates on a possible vaccine, Trump responded, "The vaccine is coming along well, and we think this is something that we can do fairly quickly." Fairly quickly in developing a vaccine, folks, is about a year and a half, because they start off initially with anywhere from 20 to 25, maybe 45 people that they test the virus on. And then that takes, 2 or 3 months for that trial to be finished. When that's done, if everything works out well, then they'll test thousands of people in another trial that will last 6 to 8 months. And then if it's still working and it's protecting, then they will start producing the vaccine, which would make it available, if it all works out and it's all good, July in 2021. So people prepare yourselves for the long haul. When asked about updates on a possible vaccine, Trump responded, "The vaccine is coming along well, and we think this is something we can do fairly quickly." Okay. Of the 15 people to have contracted the virus, 8 of them have returned to their homes to stay at their homes until they're fully recovered. 1 is in the hospital, and 5 have fully recovered. And 1 we think is in pretty good shape, he added. Okay. When they send them home to recover, that's because they're still shedding the virus. They're still contagious, even after they've had the incubation period prior to showing symptoms, and then they continue to be contagious after they've had the virus symptoms. So, there's only 5 that are fully recovered. The other ones, the first 3 cases, the couple in Illinois, and then the man that was in Seattle, who was the first case in the United States. That gentleman and the couple from Illinois, they were sent home to stay self-quarantined in their home until they were fully recovered. So out of the 15 people, there are 5 that have fully recovered. And 1 we think is in pretty good shape, he added. And I guess that's all they have to say about that. The president seemed to me like he was pretty tired from his trip to India, and then he came home to this. If you can get your hands on masks, start wearing them. Get some goggles or safety glasses to wear over your eyes to protect your eyes from coming in contact with the virus. It's very important, and they keep stressing this over and over, to keep your hands off of your face and to wash your hands really good with soap and water. That's really important to stop the spread of this virus. They're treating it like a flu, and it is highly contagious, more contagious than the flu in my opinion, and probably a lot of people agree with me on that point. But anyway, you gotta wonder, well, gee, why would we have a spread of the virus, in the United States? Geez, there's only about 1 billion people traveling just in the United States. Oh my goodness. Oh my goodness. It's unbelievable. It's just not even real. Let's go take a look at the United Kingdom. Across the sea, look at all these planes coming from the United Kingdom and Europe. And where are they going? Bum, 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 bum. Ta-da! Yeah. Okay. Here we go. And how many of them are infected? There's no way to know. And the CDC doesn't seem to be on top of checking these people for the illness. The guy, 4 days before they tested him? I mean, come on, people. I mean, they should put me in charge. If they put me in charge, we would definitely be tracking this stuff down. And the first thing I do is to ground all these planes. After 9/11, they stopped all air traffic. Didn't they? And though people had already died in 9/11, this, people, is going to cause more people to die than died at 9/11. Think about that. Think about that for a minute. Oh my gosh. Look at all of those planes. It's insane. It's just insane. Anyway, people, say your prayers. Protect yourself as best you can with what you have. And try to minimize your trips out to public places like the grocery store, any shopping for clothes, malls, movie theaters, concerts, festivals. I would just stay away from any of those large crowd gatherings. In the middle of the night is minimal people in Walmart. So you might want to think about when you're going to go to the store and what you need on your list so you're not in there just strolling around. You can get what you need and get out of there. May God protect us all. This is just insane. It's just insane. All of those little yellow spots are planes. Airliners, full of hundreds of people, each one of them. How are we ever going to contain this virus? May God help us all.